Hi, Dr. Drake here. Torticollis can be a stressful and troubling diagnosis for parents. It sometimes seems like a never-ending battle to work to get things not only back on track structurally, but also with their child's overall development. As pediatric chiropractors, we specialize in the care of these common infant challenges, and the one thing I can tell you, many of them are missed by the average pediatrician. In this video, we'll cover the four main things you need to know about torticollis plagiocephaly, including how to find out if your child has these challenges and what you can do to help. So with the rapid and significant rise in birth intervention and birth trauma, we see more and more cases of torticollis every year. Unfortunately, for most parents, traditional medicine has not updated their understanding of what's causing it and how to best take care of it for some time, leaving most families, like Nathan's family, with only traditional treatment options like physical therapy that do not get to the root cause of the problem. Nathan's torticollis was affecting his quality of life in many different ways. He struggled to hit his milestones, felt stiff, uncomfortable, and locked up most of the time, and suffered from constant ear infection. His mom was desperate to find help and relief for her baby because his occupational therapy just wasn't doing the trick. So while researching one night, Nathan's rock star mama stumbled upon chiropractic care. And fortunately, there does seem to be a shift happening in this generation of parents who are seeking out pediatric chiropractic more often and earlier than ever before. These parents and families are seeing incredible results with a more gentle, effective, and long-lasting approach to their child's torticollis. Torticollis is diagnosed medically as congenital if it is caused by abnormal positioning of the fetus while still in the womb, which is more common with things such as breech positioning or lower amniotic fluid. But the most common form of torticollis is acquired, and the most common cause is birth trauma. The amount of physical strain, tension, pulling placed on a baby's head and neck during birth interventions such as forceps, delivery, vacuum extraction, and C-section is significant and many times leaves the child with a significant subluxation that contributes to the torticollis. Subluxation has three main components: misalignment, abnormal positioning of the spinal vertebra, fixation, reduced range of motion in those segments of the region of the subluxation, and neurological interference and imbalance caused by reduced amounts of proprioception and increased amounts of nociception. Simply put, the more severe and apparent the torticollis and its related misalignment and fixation, the more severe the subluxation patterns likely are for that child. The first thing we'd encourage parents to do if they're concerned their child may have torticollis is not just rely on their pediatrician or medical doctor's exam findings. Of course, pediatricians are trained to perform physical exams in such a way as to spot neuromuscular challenges like torticollis. Still, they don't have nearly the experience or detailed training in those systems as a pediatric chiropractor or a physical therapist would. If the pediatrician does spot torticollis for a child, they most likely will make a referral to a PT, who will then show the parent a few positioning and stretching exercises they can do at home to try to help alleviate the torticollis. However, most parents report to us that those stretches and exercises are extremely painful for the child and almost tend to aggravate the condition because it leaves the child in a sustained state of fight or flight tension, something known as dysautonomia. Traditional treatment options such as physical therapy and helmets don't always get to the root cause of the neurological component. This is why parents routinely report when they put pediatric chiropractic as the foundation and first choice for their child's torticollis, it then makes all the physical therapy and stretches and positioning work easier and far more effective. So as PX docs, we love nothing more than working in conjunction with your child's therapy team for maximum results. The pediatric chiropractic approach to caring for torticollis is so often the one parents feel makes the most sense, and it can be summarized in these three simple and safe steps. Find and locate the exact location and severity of the subluxations. Make safe and gentle neurotonal adjustments to relieve the tension and to remove the subluxations. Encourage parents to watch closely for recurrence of torticollis around growth spurts, teething, colds, illness, and other stressful events the child may experience. Pediatric chiropractors look deeper than any other practitioner, using insight scans to really find and locate the exact stress and dysfunction on the neuromuscular system. One of the real keys to caring for torticollis, not just using positioning and range of motion testing as the only clinical criteria for resolving the condition. As pediatric chiropractors, we routinely examine and evaluate kids age 5 and up who had torticollis as an infant, did traditional medical and therapy treatment only, and still have retained torticollis all these years later that is easily found on our exam and insight scan neurological evaluation. In many cases, parents can start to see results and see their child experience relief in just a few visits. And overall, it generally takes a few weeks and even a few months to get full resolution of the torticollis. Before we get started, we will sit down with you at what's called a report of findings visit to show and discuss your child's exact personalized care plan and how long it takes and what all that entails. There's no cookie cutter approach to torticollis where each child gets the same stretches and positioning exercises. The examination and scan process is crucial to making sure we find the exact root cause of your child's challenges and make just the right adjustment to get things taken care of. So 1 month into Nathan's care plan, his digestive issues and eczema cleared up. In month 2 is when his mom saw a huge difference. His mobility improved drastically. He started hitting those milestones, and he said goodbye to ear infections. Super cool. If your mom or dad gut is sitting there telling you there's something going on more than your pediatrician or therapist can fully explain and address, then neurologically focused chiropractic care is perfect for you. We specialize in diving deeper and doing more thorough assessment than anyone else out there, making sure we get to the true root cause of the torticollis. Hey, if this was helpful, please like and follow us on YouTube, Facebook, and Instagram. Please ask any of your questions and leave comments below, or send us a DM. All right, we'll see you next time. Thanks.